Hi, my name is Dr. Alexa Parker, and today I'm going to be talking about some of the work that I do in my office and how I treat chronic conditions using neurological and metabolic protocols in my office for chronic health conditions. Okay. I've been a doctor of chiropractic for 11 years now, and I'm currently enrolled in a postgraduate program studying chiropractic neurology through the Carrick Institute. I've also studied functional blood chemistry, functional endocrinology, and functional neurotransmitters through Dr. Datiz Karazian. Along with that, I've studied under Dr. Michael Johnson, who is the author of the book, What Do You Do When Medications Don't Work? Through also studying through Apex Energetics, we've studied biomedical and nutritional products and supplementation, which is used for chronic health conditions. Some of the things that I actually work on in my office or conditions are fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy, rheumatoid arthritis, chronic pain, autoimmune disorders, hyper and hypothyroid, IBS and GERD, insomnia, digestive disorders, migraines, ADD and ADHD. What we have found that a lot of these chronic conditions have common links here. And generally, these are the things that I check for in my office. So the first one being oxygen deficiencies. Generally, when people have chronic conditions, they can't move as well, and they can have problems with uptake of oxygen. Also, neurological degeneration. Metabolic imbalances such as blood sugar regulation problems. Even if you don't have, insulin dependent or dependent diabetes, you still may have hypoglycemic episodes and insulin resistant episodes. So we really want to investigate that because that can definitely tax your system. Cortisol. When someone has stress, physical, emotional, or chemical stress, their body produces cortisol through their adrenal glands. And what we want to do is actually determine, are you producing too much or too little cortisol, which can have an effect on how your body functions. Hormones, women that have had children or women that have been on estrogen replacement therapy, that can have an effect on their thyroid hormone, and it can contribute to hypothyroid or hyperthyroid. Also neurotransmitter problems, anemias, autoimmune attacks. In our country, we have the majority of people that have thyroid conditions are actually an autoimmune disorder. So therefore, we really want to look at the blood and the factors in the blood that can actually indicate that we have an autoimmune disorder, as well as what is actually causing that autoimmune attack. We really want to work to calm that autoimmune attack down, so therefore the person can not only feel better, function better, but also really eliminate future problems. Brain imbalances. What makes me different, or our office different, is that we actually treat patients neurologically and metabolically. We leave no stone unturned to really determine the exact cause of your condition. We treat the individual. We run labs based on their specific health needs, not just what the insurance covers. We look at you from a functional health versus a disease view, and we treat metabolically and neurologically. All cases are a combination of neurological treatment and metabolic treatment. One of the things that I use in my office is computerized blood chemistry analysis. This gives us a functional range to determine if your status is actually in a healthy functional range that a functional healthy individual should be in. It actually allows for more comprehensive evaluation of your health versus just looking at disease markers. And it also helps to determine your nutritional needs. Chronic health conditions are a sign of metabolic dysfunction. Proper testing is crucial. Some of the things that I want to look at are things like a complete metabolic profile. A lot of times when a patient comes in and I see the labs that they've had very little labs done, and it really doesn't help us indicate where the problem is. So a complete metabolic profile would actually include, specifically for a thyroid patient, a thyroid panel, as well as thyroid antibodies. We would want to check things like vitamin D levels. We would want to check for anemia, kidney function, that type of thing. If I suspect that you have an autoimmune disorder, We would want to look at your immune panels. You've got two sides of your immune system. The first reactor that responds immediately, and then the late reactor that actually makes antibodies. Adrenal stress index, looking at your ability for your adrenal glands to produce cortisol, which is the hormone that actually keeps you alert and awake. And if I find that you're unable to get out of bed in the morning, but yet having a lot of insomnia and difficulty sleeping, we'll actually want to look at those adrenal or that salivary adrenal stress index. Food sensitivity test, ruling out gluten, soy, egg, or yeast sensitivities. Also, I look at stool profiles to determine if you have gut infections, parasites, and yeast infections. Many patients that have chronic conditions have a really poorly functioning gut. So we need to look at the health of the gut, and the best way to do that would be through the stool test and also the food sensitivity test. Okay. So we want to look at a true thyroid functional test, looking at the TSH, also looking at the free thyroxine index, the free T4, the free T3. So how are they being taken up in the blood? Also free T3, reverse T3. We want to look at TPO and TBG antibodies. This will let us know if you actually have an autoimmune attack against your thyroid. Someone who has an autoimmune attack against their thyroid is actually destroying their thyroid gradually over a period of time. So we really need to determine if that's the case with you, as well as how can we stop it from progressing so that it doesn't attack other tissues. So we can really halt that autoimmune disorder from getting worse, and also work on getting you healthier to really allow your body to work a lot better and not produce more antibodies. TSH antibodies, which is what we see with Graves' disease. Also TBG levels, thyroid binding globulin levels, which can be impacted by hormones. Functional medicine. Based on lab findings and health surveys, our nutritional products are dispensed to support the biochemical pathways for healing. So we look at the gut, we look at the thyroid and the adrenal glands, we look at the liver and biliary glands. We look to see if you have anemias, sugar regulation problems, and autoimmune regulation problems. Have you been told your lab tests are normal? Lab ranges are inaccurate. Basically, your labs are generally compared to anyone that has been to that lab for the past year to come up with a normal. Okay. Functional lab ranges, however, are a lot narrower. So rather than use sick levels to determine whether or not you're healthy, or sick ranges, which traditional lab ranges use. So for example, for someone to check blood sugar, glucose, the traditional lab range actually says that normal is between 65 and 110 milligrams per deciliter. If you look at the functional ranges, however, the functional range is between 85 and 100. Therefore, if someone is, for example, let's say someone is 73 for their blood glucose, that would actually make them functionally hypoglycemic, okay? So can you see then how several things can be missed if we use those traditional lab ranges? Another example of that would be TSH. A normal functional range is 1.8 to 3.0. However, traditional lab ranges look at normal being 0.3 to 5.7 milliliters per UL versus ours, which is 1.8 to 3.0. So for example, if someone has a functional thyroid condition, they can, if they're outside of that 1.8 to 3.0, to us that indicates that this person has a functionally low thyroid or functional thyroid issue, which can easily be missed. Another example would be hemoglobin. Normally, when we look at someone to rule out anemia, we want to look at one of the indicators, which is hemoglobin. And for a functional range, it should be 13.5 to 14.5. Women being 13.5 and men being 14 to 15 or so. If we look at the normal traditional ranges, it would be 12 to 16 grams per deciliter. So for example, if someone has a hemoglobin of 13, they could actually be functionally functionally anemic. So we really want to take a complete approach. We want to look at the complete metabolic panel. How is your blood sugar? Are you fluctuating between hypoglycemia and insulin resistance? Your lipid panel, your complete blood count. For example, your white blood cells and your red blood cells, are they within the normal functional ranges? That could also tell us, like, for example, if you have an underlying chronic virus or chronic bacterial infection, which could be missed. Also, if someone has a thyroid, or we suspect that they have a thyroid condition, or they have chronic fatigue, we'd want to look at that thyroid panel. Are they producing antibodies against their thyroid, which again means that they have an autoimmune disorder, in which case we've got to get them healthy on a functional level in order to correct that autoimmune condition. The test that I utilize for the adrenals is called the Adrenal Stress Index. This test really tells me, are your adrenal glands producing cortisol in the morning and therefore making you alert and allowing you to have energy for the day? Also, is a cortisol level lowering at night so that you can sleep? And this really tells us how is your body responding to stress. Normally, your adrenal glands really allows us to respond to stress by producing cortisol. If we've been under chronic stress because of, for example, blood sugar fluctuations, gut problems, foods that we're eating that we think are healthy but we don't realize we're sensitive to, it's putting chronic stress on our adrenal glands. Also, things like functional viral or functional bacterial infections can really tax the adrenal glands. So we really need to look at this so we can really work on your functional health. The other test that I do is called the DNA stool test. Generally, these chronic conditions such as fibromyalgia and chronic fatigue and thyroid conditions, as well as autoimmune conditions, have poor gut health. So they have problems absorbing their nutrients, and they also have problems with having enough bacteria, good bacteria. This test actually tells us if you have adequate good bacteria with adequate probiotics, and maybe if you've been taking probiotics, if you're actually producing enough of the good bacteria that you need for your immune system to function well. Because about 70% of your immune system is actually in your gut. We also want to look at if you have bad bugs in your gut. Are you producing pathogenic bacteria such as E. coli or staph infections, or if you have parasitic infections or H. pylori infections, which are very common as well. That way we can actually work on killing those things and restoring the normal gut flora and allowing you to actually be able to break down your food and absorb your thyroid hormone as well as absorb your nutrients. Food sensitivity test. The big five things that I look at in regards to foods, the first one being gluten, which is the protein in wheat. Actually, the protein is gliadin, which is the wheat in wheat. And also casein, which is the protein in dairy products or milk, egg, soy, and yeast. These are actually the big five foods that can really damage the gut and also really encourage the autoimmune system to become much, much worse in the genetic sensitivity in the person who's genetically sensitive. So we really need to rule those things out, because if someone has an autoimmune thyroid condition or an autoimmune disorder, generally we will find that they will be producing antibodies against these foods. So we actually run a genetic test to determine if they're sensitive to gluten, and also if they are producing antibodies against casein, egg, yeast, soy, and actually milk. Okay. With this sensitivity test, it's generally utilized for patients that have chronic fatigue or chronic pain, indigestion, fullness after meals, bloating after meals, frequent loose bowel movements, constipation, and also vomiting and nauseousness. Generally, we find these chronic conditions often have these food sensitivity problems, and once we're able to determine exactly what they are, we can remove them and really help their system, restore back to normal and to being a much healthier individual. The other test that we may look at is the intestinal permeability test. Do you have a normal healthy gut? Do you have the normally strong junctions in your gut that you need to have? And we do that through a stool test. Okay, I'm going to go back to that one. Okay. The other test we may run is an intestinal permeability test. And this is a test where you actually ingest sugar molecules to determine the health of. Yeah, I'm going to skip that one. Is that okay? Okay. Okay. We also test for leaky gut syndrome, which is when Okay, I'm just going to stop. We also check for leaky gut syndrome. The main other thing that we look at, if we think that someone is suffering from an autoimmune disorder, okay, is we really want to determine where is that autoimmune attack taking place, what's causing the autoimmune attack, as well as where is it taking place. For someone who has fibromyalgia, oftentimes they can be producing antibodies against their joints or their muscles. Someone who has rheumatoid arthritis can be producing antibodies against their joints. Someone who has a thyroid disorder can be producing antibodies against their thyroid. The main thing here, again, is to not just think about the specific gland where the problem is, but actually determine what is causing it, what's driving that autoimmune attack. Does the person have a virus, parasitic infection, or a bacterial infection that is actually damaging their immune system and driving this autoimmune disorder? Are they eating foods that are causing this autoimmune attack? Or are they having chronic blood sugar fluctuations that are driving this autoimmune attack? That's how we have to really approach this. We have to look at it from a whole body standpoint and correct those underlying causes, okay? Again, if we suspect there's an immune problem, we want to look at, is the immune system dysregulated? Do we have problems with the balance of the two sides of the immune system? Or do we have an active antigen attack? Again, chronic infection, parasitic infection, gluten or wheat sensitivity, environmental toxicity, that type of thing. We also would look at H. pylori, and that's actually done through the stool test. We look at the DNA, or we determine if there's a DNA for H. pylori in your gut. The other thing we want to look at is actually we use a symptom survey to determine if your neurotransmitters are adequate. And we know that people that have chronic conditions oftentimes do have brain fog. They can't focus, they can't concentrate, they can't complete tasks, they get depressed. So we actually look at those neurotransmitters and we use supplementation to replace those. We can also run hormone panels looking at estrogen, in some cases testosterone. We can look at all the precursors to those hormones. Specifically, we want to start, though, with the adrenal gland function, because that really helps produce the hormones. Have you had all of these tests performed by other doctors? And if not, why haven't you? Along with some of this testing, we also do neurological treatments based on specific neurological testing. With my comprehensive neurological testing, I'm going to actually look at things like, how is your nervous system functioning? Is your blood pressure even on the right and the left? Is your tissue oxygenation equal on both sides? How is your heart rate and your rhythm? How are your reflexes? Are they even on both sides? How about your eye movement? How is your balance? How is your memory? All of those things are important to determine how much this metabolic problem has damaged your nervous system. Once we find out what the problem is, we work on actually fueling the brain too. So we can actually use exercise to drive oxygenation and activate the neurological pathways, the brain, to really get you feeling better and functioning better. We also use brain-based therapies, things like the interactive metronome, which tests and tracks your ability to move in time with a sound. This can actually help activate the brain, which is really important in reestablishing normal function and focus and concentration. We also use things like eye lights to stimulate the eyes. Basically, we use things to stimulate the brain. So we use the eyes, we use the senses, the nose, we use movement, we use vibration therapy and things to actually stimulate the brain. Basically, it gets stimulated by movement and by activation. So that's what we do in our office. By correcting the brain that's misfiring and the metabolic dysfunctions, we can actually restore the health of the individual. How has your chronic health condition affected relationships, your family, your finances, and other activities? Are you fully enjoying your life? What does your health condition cost you in time, money, happiness, or sleep? Where do you picture yourself in the next 3 to 5 years if the true cause of your health problem is not corrected? If what I'm talking about today sounds like something you would like to be evaluated for, if it sounds like what you've been looking for, the next step is to download the new patient paperwork at www.parkercare.com and schedule your new patient exam today.